Joining us now, Dr. Regina Davis Moss, the president and CEO of In Our Voice. Doctor, good morning. Thank you so much for joining us.
Hi, Hannah. Thanks so much for having
Of
me.
course.
And let me tell you,
Yeah.
this is such an important conversation. I am so glad you're bringing this up.
Well, thank you for coming on, because you're right. This is very important. I've said it before, it's dire. The separate SNAP program for women, infants, and children got a funding boost earlier this month. But there are concerns that they may be running short, too. What's your expectation there, doctor, on whether enough states and cities will be able to keep their WIC programs running?
Let me just tell you, this is absolutely devastating. The Women, Infants, and Children program, which you are correct, is different from SNAP. This is one of our greatest public health achievements. We are talking about the difference between a baby going to bed with a full stomach or families having to scramble to put food on the table. The WIC program is for working families. You know, these are low income, but these are people that are working. These are your neighbors. These are the moms. These are the kids down the street that need to have food. And these are, we are providing things like infant formula. You know, have you gone to the grocery store and seen how much this costs? Top $20 for a can. Toddler formula even more. But diapers costing $50 or more. This makes the difference between life or death, and we should not be on a political brinkmanship about these sort of things.
And you've been sounding the alarm, rightfully so, on how these federal food aid freezes will have a disproportionate impact on Black families, families of color. How much of a setback could this be, given the other challenges, like you mentioned, grocery prices rising and just the cost of living on top of everything?
Right. I mean, these are, when we're talking about the outcome of this, Black families are disproportionately impacted. But I want to say that it's not just Black families. Large majorities, white, Black, brown, rely on these programs. We need these programs. These are the programs that are going to make sure that we have safer pregnancies, safer outcomes, and we want kids to celebrate their first birthday.
What advice are you giving to women who are unsure of where to turn if they need food aid, if they need to feed their children, when they need to feed their children?
You know, I want people to make their voices heard. We're in the middle of a shutdown, but this is just a preview of what is going to happen. The big, beautiful bill, as they would like to call this, we will see the impact of these cuts to SNAP and WIC in 2030, and this is going to hurt. So, this should make people angry. Call your elected official. Tell them to stop playing political chess with families and people's lives.
Dr. Regina Davis Moss, thank you so much. Like we said on the top of this interview, this is a very important topic. We appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.